Good morning, everyone. I'm Rashad Safir, and I'm the president and CEO of the Bobby E. Wright Comprehensive Behavioral Health Center, and along with my partner, Donald Dew from Habilitative Systems, I'm the co-founder and director of the Westside Community Triage and Wellness Center. I'd like to welcome you to the Westside Community Triage and Wellness Center this morning. We're really happy to host this press conference where the governor will announce the state opioid action plan. Let me tell you a little bit about this place where we are. This center was started in 2018 as a pre-arrest diversion and deflection program with the primary goal of keeping people out of Cook County Jail and reducing unnecessary psychiatric hospitalizations for individuals with serious mental illness and substance use disorders and those who have co-occurring conditions. With the support from the Cook County Health, the Chicago Department of Public Health, and the Illinois Department of Human Services, our service model has expanded from deflection and diversion to include street outreach for substance use disorder and opioid use disorder, community outreach and engagement, fitness diversion, crisis counseling, trauma-informed therapy, and mobile crisis intervention. We provide services primarily in the communities of East and West Garfield Park, Austin, North Lawndale, and parts of Humboldt Park. According to data from the Chicago Department of Public Health, these communities are among the most affected by the opioid crisis. In 2018, these communities accounted for 29% of opioid deaths. There were 183 deaths in these communities on the west side. More recent data from the Chicago Department of Public Health mid-year report from January to June 2021 indicates that the situation isn't getting any better, with 122 deaths in the target communities for that short time span. These communities have the highest rates of EMS responses for opioid overdose, and as I mentioned, they have the highest rates of opioid deaths in the city. So given these circumstances, I think it's quite befitting that the governor chose the West Side to make this especially important announcement. He and his staff have heard our call for help and are paying attention to how racial disparities in the opioid crisis is affecting our West Side communities. We're very appreciative of the work that his administration is doing to address this issue that has been devastating our communities for decades. So without any further delay, I am very pleased and honored to introduce the Honorable Governor J.B. Pritzker. Let's give him a warm welcome as he makes his way to the podium.
Well, thank you very much, Dr. Safir, and thanks to everybody who's joined us this morning for this important gathering. I want to especially acknowledge the tremendous work that's being done here at Bobby Wright, which has saved so many lives on the west side of Chicago for decades now, for 40 years. I'm so grateful and thankful for your service, for everyone who works here, and I can't think of a better place to share the news that we have today. Thank you also to Donald Dew, who you'll hear from in a little bit, for inviting us to share this space and to allow us to use this as a place of hope and healing, as it always is. In January of 2020, I issued an executive order pursuing an equity-focused plan to end the opioid crisis and expand access to those in need of help. My administration has worked closely with community providers, experts in the field, and people in recovery to produce a comprehensive statewide overdose response plan anchored in equity. Equity is always urgent, but in this work, even more so. I issued my executive order recognizing that even though overall opioid deaths were decreasing, deaths specifically in Black and Latino communities continued to rise. 2 years ago, when we set out on a mission to end the opioid epidemic, we also got hit with the coronavirus pandemic, leading not only to almost 1 million American deaths from COVID-19, but the deadliest overdose year on record. In Illinois, the number of opioid overdose deaths in 2020 increased 33% compared to 2019. Communities of color, including here on the West Side, have experienced some of the highest rates of overdose deaths in the entire state. There are so many people who end up in a struggle with the disease that is addiction, self-medicating, trauma, simultaneous mental health challenges, a pain prescription gone wrong. But no matter what brings someone here, their life is worth saving. That's why today I'm announcing the state of Illinois' Overdose Action Plan. It's the product of the last 2 years of work and a robust and comprehensive vision to provide all Illinoisans access to the behavioral health and social supports they need to recover. The plan builds on strategies that I outlined in my 2020 executive order that strengthened the state's commitment to ending the opioid crisis, but does so with additional emphasis on harm reduction and social equity. Throughout my governorship, we've recognized how connected these problems really are, from homelessness to hunger to disease to the struggles of getting and keeping a job. We strive to address this in everything from our rental assistance programs to food and nutrition access to the overdose action plan that we present today. We're working to end the racial disparities that come from historical institutional failures. Recovery belongs in all of our communities, but accessibility is key to getting people on the road to success. I want to thank the Illinois Opioid Crisis Response Advisory Council for their ongoing commitment to this vital work to reduce overdoses and save lives. I also want to thank Lieutenant Governor Juliana Stratton, the chair of the governor's Opioid Overdose Prevention and Recovery Steering Committee, as well as our committee co-chairs DHS Secretary Grace Ho and former IDPH Director Dr. Ngozi Ezike for their leadership. And we're not wasting any time implementing the plan. Already, DHS has begun providing mobile medication-assisted recovery via mobile van outreach on Chicago's west and south sides. More than 300 people attended IDPH's recent harm reduction summit. Learning collaboratives are supporting sheriffs and their county health partners in reducing recidivism and post-release overdoses in people leaving jail. And that's on top of other initiatives undertaken since my 2020 executive order. Let me give you some examples. We've expanded the overdose education and naloxone distribution services, delivering more than 65,000 kits in FY 2021. And we're on track to beat that this year, with over 50,000 distributed already to date. We've increased access to recovery homes so people in recovery can have a safe, stable place to live in the early stages of their journey. Community organizations, clinics, and hospitals can now receive no-cost naloxone through our Access Narcan project, ensuring that at-risk patients can have the supplies right as they leave the healthcare system. We're expanding the numbers of doctors who prescribe medication-assisted treatment to opioid patients. And the 24/7 Illinois helpline continues to connect patients to emergency response, intervention, treatment, and recovery services. This plan is all about deploying behavioral health assistance to support any Illinoisan who is fighting opioid addiction. In my State of the State address last month, I told you that I would be appointing a chief behavioral health officer to oversee and coordinate behavioral health services directly with the governor's office. So I'm proud to announce today that David T. Jones, the outstanding current director for the Division of Substance Use Prevention and Recovery at DHS, will be stepping into that role. His leadership and guidance will tremendously advance behavioral health outcomes in this new role. David is tasked with the mission of transforming how Illinois supports mental and emotional health needs, as well as substance use disorders, and he will lead the development of recommendations for our future state infrastructure in behavioral health. Here's the truth. Everybody knows somebody who's struggling. Everybody. And our systems need to reflect that, because pain left in the shadows hurts us all. So if you're struggling, know that your fight is my fight, and the government of the state of Illinois is here to assist you. So I want to thank all of you again, and with that I want to turn it over to a true force of nature in ensuring that Illinoisans can find and access the supports they need to build better and more resilient lives, and that's our outstanding Department of Human Services Secretary, Grace Ho. Grace?
Good morning. Thank you, Governor, for your continued leadership, compassion, and commitment to ensuring that the people of Illinois have a strong and healthy human services system. I'm so proud to stand here with you, our Governor, our esteemed partners in the General Assembly and the county and community leaders to lift up two important and aligned life-saving areas of work: the launch of the Overdose Action Plan and the naming of David Jones as the Chief Behavioral Health Officer. It has been a true pleasure and honor to work with Lieutenant Governor Juliana Stratton as we co-chaired the statewide Overdose Action Plan together with former Director Ngozi Ezike and now Director Tokars. Lieutenant Governor was instrumental in our collective work, leading with grace, strength, and equity. Our work was facilitated by the leadership of David Jones in his role as a director of Super. And I'm so pleased that I will have the opportunity to continue working with him in this broader role as he steps into the role as the state's behavioral health officer, which will be housed at the Department of Human Services. We will continue to be partners on this truly important work. He's a phenomenal, experienced, and truly thoughtful leader, and we are so lucky to have him in Illinois. The work of the SOAP was developed through a racial and social equity lens, which charged all of us to concentrate our recommendations, interventions, and investments in those hardest hit areas. Also recognizing that to beat this epidemic, we have to work with communities in ways that are true to their assets and their unique challenges. We are here on the West Side to lift this work up because even as the nation, our state, and different communities across the state experienced an increase in overdose deaths these past years, these losses of life were felt here in this community and in the South Side of Chicago even more so. The SOAP was a culmination of the work of dozens of state agencies, over 300 members, experts, providers, and people with lived expertise. Those leaders, like Luke and Gail here with us today, have invested their time and talents and have shared their own personal journeys to recovery so that others may also find their way. So while we officially launched the report today, please know that the work has already been ongoing and we've already begun implementation on a variety of innovative practices. Right here, the West Side Heroin Opioid Task Force continues to actively engage people on the West Side in discussions about how to make sure that people are safe and can find recovery in these neighborhoods. We've also launched Anti-Stigma Campaigns. We have an Illinois helpline. For those who are in need of services, they can call 1-833-2-FIND-HELP. Much has been accomplished, and yet we recognize that there is more to do. We will continue to stretch and expand so that recovery is within reach for any who need it. And now it is truly my great pleasure to introduce Luke Thompson, a strong advocate and partner for all of this work. Thank you, Luke.
Good morning, everyone. My name is Luke Thompson. In 2015, I overcame a chaotic 14-year heroin addiction. I was a familiar face in a small town. I came forward with my story to reduce stigma and to give voice to the voiceless. I am a survivor, but I've also lost a lot of friends. I'm fortunate to be here today because I practiced harm reduction. I had a supportive family. I had access to insurance, medical care, and treatment. I had a safe living environment, and I had people who believed in me when I needed help. There are many people who don't. I am proud to be part of the Governor's Overdose Steering Committee and applaud the state of Illinois for creating a seat at the table for the voice of lived experience. Understanding that former and active users play a critical role in preventing and reversing overdose. We have a deep understanding of our lives as well as the barriers we face and how to survive. We understand the isolation like us experience due to stigma, shame, and criminalization. And we know how to meet people without judgment and treat us as humans first. We understand a drug and alcohol-free world is an impossible goal, and people need support, not punishment and shame. Our paths are all different, and we all face challenges in our lives. My role as an advocate is to empower and uplift a diverse group of voices of people like me, to provide support and hope in a non-judgmental way. I can represent a small-town drug user who has experienced stigma, shame, isolation, and other real disparities. But there are many other barriers I cannot begin to relate. This plan prioritizes engaging a much more diverse group of people with lived experience, from the most marginalized and at-risk communities, including the Black and Latinx communities, active drug users, individuals incarcerated for drug use, and leaving jail or prison, where the disparities are the highest. Overdose death affects all of us, and we must take bold action to reverse these troubling trends. People are dying in record numbers. Each death has a multi-generational effect on families in our communities. These lives are mothers, fathers, brothers, sisters, sons, daughters, nieces, nephews, aunts, uncles, spouses, and partners. I am just one voice of many statewide advocates. As advocates, we carry these lives in our hearts. These lives will not be lost in vain. They will not be forgotten, and we won't stop until we see these trends reversed. Thank you.
So, thank you, Luke, both for your courage in sharing your story. I also want to thank Governor Pritzker for selecting me to lead what will be transformational change of the broader behavioral health system. As David T. Jones, am just really honored to be here. I also want to thank what I would refer to as the Mount Rushmore of women committed to playing a role in helping implement this transformational change that will occur, inclusive of Lieutenant Governor Stratton, former Director Ezeke, now Interim Director Tokars, Deputy Governor Flores, Lizzie, Director Eagleson, and of course the awesome Secretary Ho. All have played a part in leading the development of the new State Overdose Action Plan, and we know because of their collective support, they will sustain the open doors of change. As a Chief Behavioral Health Officer, I will work with people with lived experience or expertise, behavioral health providers, trade associations, elected officials, people who use drugs, and other stakeholders to transform how Illinois supports mental, emotional, and overall behavioral health wellness for everyone. To be clear, there are many committed behavioral health providers currently delivering evidence-based and evidence-informed prevention, intervention, treatment, and recovery supports. Our work will include both building upon the good work currently occurring and scaling up coordination across departmental agencies to facilitate greater treatment effectiveness, fiscal efficiencies, and health outcomes. As we advance to better align, coordinate, and integrate the infrastructure to expand the behavioral health system, we will be intentional to listen to community members, be intentional about including historically marginalized communities as well as African Americans, other Black and brown people, and other people of color. We certainly will continue to rely both on data and science to inform the further development of a statewide comprehensive behavioral health system. For example, the governor this past Friday announced Dana Weiner will lead the development of a children's behavioral health system. It's this type of vision and coordination that will result in more effective behavioral health services for children, family, and all individuals seeking prevention, intervention, treatment, and recovery support services throughout the state of Illinois. Finally, I want to be explicit in stating that both the framework of harm reduction and connecting treatment along with recovery supports with the social determinants of health, such as employment and housing, will be incorporated into our design. We will coordinate with the Chief of Homelessness, that's Christine Haley, other research partners, such as the Office of Medicaid Innovations, and others, to increase mental, emotional, and overall behavioral health wellness for everyone. And with that being said, it is now my pleasure to introduce Gail Richardson.
Good morning. My name is Gail Richardson. I'm from the West Side Outreach Task Force Heroin Opioid Prevention Center, and I am an outreach specialist. The reason why I'm such a good candidate, I am a recovering addict. I've been to federal prison 13 years, and I've been home 7 years, and I'm still holding on. My job as an outreach worker is to go out and to engage with the community. Let them know that we're here to provide different services, to provide Narcan. We have providers out with us as well, if just in case someone wants treatment. So far this year, we've trained, as of February, we've trained 6,294 people on how to use the kits, how to save lives, how to reverse the overdoses. We visit 677 sites on the west side. We cover from Austin to Sacramento down to Cermak. We cover all that area. And what we do is we go out, and we've also talked to people where kits has been used on them. 20 people have told us 20 kits have been used on them and reversed their lives. We also we talk to people in the community that have used kits, that we've already gave kits to. We keep a data of who we gave these kits to, and we ask the people, have you used the kit for? What happened to the kit? What did you do with the kit? And as of 2022, 120 people have used the kits to reverse an overdose. So I just want to let you all know, we also, with the referrals, we have doctors that are there with us sometime. We have people out there that's giving IDs, if anybody interested in giving IDs. And we basically tell people our story. We let them know that you can do it. And if you fall down, get back up again. Okay, and thank you.
Thank you. Let me congratulate you and Luke on your recovery, and anyone else in the room that's dealing with recovery, and anyone that has a family member like me that's in recovery and that's been struggling with a substance use disorder. It's a big deal. And so, Governor, I congratulate you on doing this. This is it's an international problem. It's a real problem that we all have to face, but of course, it is prevalent right here on the West Side. And we have some great partners right here, Governor, on the West Side. And I just want to call them out, starting with Dr. Deere is a great partner on the West Side Opioid Heroin Task Force. Alderman Jason Irvin, proud father, partner of the Opioid West Side Heroin Task Force. Commissioner Brandon Johnson, a partner. And of course, Donald Dew, a partner on the Opioid West Side Heroin Task Force. Dr. Saphir. And I feel like I have to say that, you know, your Secretary Holt, is at the meetings all the time for the West Side Opioid Task Force, so she's a partner. And also my colleague, Lakeisha Collins, who takes no mess from anybody, is a partner on the West Side Opioid Task Force. And also Director Jones, congratulations. He's a partner. He's been on all of these meetings helping us. And we also have to say who's leading it also is, are you Lee or Lou? I'm Lee. Lee, Stan, and Lou. So I mix them up. I don't know how, but I mix Lee and Lou up. And also Brad Cummings for being a good partner in making sure that we cover it. And of course, the pastor, I'm not going to forget you, because you're always calling, making sure that this West Side Opioid Task Force stays on track, and that's Reverend Jones. Thank you so very much. So one other thing that I have to say before I show why one more thing before I say why it's so very important to Alderman Mitz. Oh my goodness, I didn't see you there. Oh my goodness, that would have been it. Alderman Mitz, and you know what, I didn't see you. But let me tell you, somebody that knows how to whip them together and keep the West Side Opioid Task Force together, hosting the meetings. Thank you so very much, Alderman Mitz. And see, that's why we have a good team, because let me tell you, Lou saw that I missed you, and he got me in order. But one thing that I have to say that I have to give the governor credit for before I go over why this plan is so very important. There was a Good Samaritan law that said that if you saw someone dying of an overdose and you're on probation, you couldn't call for help. You had to leave the person there to die. Governor, thanks for signing the legislation reversing that, because now you don't have to go to jail for helping save someone's life. And so the plan that the governor announces is so critical, because the numbers show that every year 30,000 Illinoisans use heroin. 74,000 have an opioid use disorder, and nearly 400,000 misuse prescription opioids. In Illinois, we saw 2,151 opioid-related deaths in the first 3 quarters of 2020, a 36% increase from 2019. In Illinois, there were a total of 14,592 non-fatal opioid-related overdose across the state prior to the COVID-19 pandemic. The COVID-19 pandemic has generated a surge in heroin opioid emergency department visits for overdose, and overdose numbers were above the average monthly rate for 6 consecutive months in 2020, increasing the urgency and need for immediate access to care. And here's the big one. The total economic and social cost of opioid use disorder and fatal overdoses to the state of Illinois exceeds $41 billion annually, equating to $600,000 for every Illinoisan with an opioid use disorder, while only $121 million of the total, less than 0.3%, is used for treatment. That's sad, and that's why we see so many people dying. And that's why this plan is important, because now we're going to be able to use a plan to help with prevention, treatment, and recovery. As of today, fewer than 10% of individuals with a substance use disorder receive treatment. And finally, right here in West Garfield Park, it has the highest overdose rate in Chicago and probably in the world. But 60% of those deaths live in communities outside of West Garfield. That's according to data of 2020. That means that people come to the West Side not to shop for goods and services, but to buy drugs. And so we need help to make sure that we reduce the flow of drugs right here on the west side of Chicago. In Chicago overall, in 2020, of the 1,303 overdose deaths, 57% were black, 26% were white, and 15% were Latinx. What we know now is more deaths from opioid overdose than we see with guns and car accidents combined in Illinois, even though we hear a lot of people dying of gun deaths on the west side of Chicago. Still, the deaths from opioids is higher than guns and car accidents. So, Governor, your plan is very timely, and we thank you very much for a strong team to put it together. Thank you very much, and I'll turn it over to Governor J.B. Pritzker or Donald Dew, the sheriff. It got out of order. I don't know. You do it.
Yep, I'm going to turn it over to our great sheriff. Yeah, Sheriff.
Morning, everybody. Any Kane County voters here? We'll go ahead anyways. Okay. So, yes. So it's incredibly important to view every county's jail as a fusion center for all of that community's most serious issues. And that was my mission when I took over as sheriff, to begin looking at our incarcerated population and start turning our county jail into a true correction center, not just a warehouse for human beings. When we talk about addiction issues inside of a county jail, as much as 90% of those in custody struggle with addiction issues. And historically, many jails, including my own, did very little, if not anything, to treat those issues. We talk about that racial disparity and how addiction affects black and brown communities. Another very important statistic I wanted to know from my staff when I took office: what is our black population in custody? It was as high as 46% at the time, when our community's black population countywide is 6%. If that doesn't say disparity, and if that's not a charge to rage against, I don't know what else is. So it was our goal to begin triaging people in custody. And our belief was you become justice involved on one of three pathways: mental health, addiction, or lack of opportunity. So we wanted to design our jail to address all those issues, and we created a new cell block that we call Recovery Pod. Recovery Pod is like no other cell block that we've seen in a county jail around here, and it was like no cell block that we've ever seen within our own jail. And the whole design was to deliver intensive addiction treatment, vocational training, job placement, and of course reentry services, so when people leave us and go home, they don't come back. This started 3 years ago. And it was very important for us to, of course, track data, because data shows what works and what doesn't. Over the last 3 years, we've dropped our opioid overdose deaths of the formerly incarcerated by 89%, leaving the Kane County Jail. Recidivism has gone down from 49% average to 18% in Kane County. Jail violence is down 35%. The jail population is down 38%. Countywide crime, to prove this all goes hand in hand and it works, countywide crime is down 16%, because what you do or don't do inside your county jail directly affects public safety on the outside. And through all of this work, we've saved our taxpayers in Kane $4.6 million over the last 3 years by providing these services. So folks, I'm here to tell you, this saves lives, it saves money, it reduces crime, and it builds bridges between law enforcement, those that wear the uniform like me, and those marginalized communities. And now more than ever, we are so excited that Governor Pritzker is moving us forward with this new opioid response plan. Thank you very much.
Good morning. Good morning. My name is Donald Dew. I'm President and CEO of Habilitative Systems, Inc. I'm so happy to follow the sheriff because, you know, we in our audience today we have Ms. Sharita Logan, who's a representative from Congressman Davis's office. And as we all know, the congressman passed landmark legislation around the Second Chance Act, which brought so many persons who are institutionalized and incarcerated, in large part due to issues struggling with substance abuse and mental illness, brought them home and gave them a second chance. So we really appreciate the congressman with that legislation, and certainly our Department of Correction officials. We know that the congressman was also working with Director Jeffries at Department of Corrections in a number of different efforts. So we really applaud these efforts. It's fabulous, really, really great. Governor Pritzker, thank you so much. This state overdose action plan is so critical, so important to our community. And, you know, it's the kind of thing that talks about, in one form or another, the power of possibility. You know, when people come together, you know, it's really indicative of what can happen in terms of, you know, impact in the community. Our governor has continually demonstrated the power of possibility and collaboration, and we're so pleased about that. You know, our governor has created the healthcare transformation collaboratives, creating statewide issues around healthcare, dealing with issues around healthcare disparities and institutional racism, and he understands very, very clearly that, once again, this SOAP strategy is going to bring people together in a very meaningful way. And let me just step back for a moment and talk about why it's important that we're here today in this particular facility. We also have with us today Israel Roca, the CEO of Cook County Health. You know, they were responsible for creating the funding several years ago for us to transform this facility from a Ameritech bill payment center. Can you all imagine that? This used to be a Ameritech bill. Some of you all may be old enough to remember that. All right, we used to come right here and pay our bills, right? But, you know, this place was transformed, right? Right here to create opportunities, as my colleague and co-developer of this Westside Community Triage and Wellness Center, Dr. Safir, illustrated. But the very first thing that we did out the gate, Governor, was we dealt with the opioid crisis. We went into the streets and we began screening and ensuring that folks who are suffering and in pain from opioid addiction and severe mental illness knew that there was a resource available here on the west side of Chicago. You know, Habilitative Systems has been serving the west side of Chicago since 1978. People with disabilities, people with mental illness, substance abuse, all these persons in pain have been receiving these vital services. And we are only in existence because of collaboration, because of support. We started out at Clare Christian United Methodist Church, part of their community ministry. People are saying now more than ever before, we have got to come together. If we don't come together to make change happen, it's not going to happen. And it's our watch right now, ladies and gentlemen. It's our watch. It's about what we do with our time right now. I'm so happy that the governor, for example, in Census 2020, I got to say it, Governor, you did it. You know, when we were talking about Black Lives Matter, the governor put money behind the effort and said, well, let me get it correctly. Let me do the right thing. He said everybody counts in the state of Illinois. And he put all kind of money out here to make sure that people were counted. Secretary Holt, through the Department of Health, Department of Human Services, led the charge. HSI was able to be the lead agency with 30 different organizations. 8 communities were served and impacted on the south side, another 5 on the west side. 13 community areas were served and counted in the census. But guess what? It was, again, the power of collaboration. And what we did, very interestingly enough, during that time, Secretary Holt knows it very well, is that we engaged in social determinants of health screening. And yes, we were able to find out during that time, Mr. Governor, that several people that we were trying to get counted were in fact suffering from opioid addiction, suffering from mental illness. And we were able to get thousands of people referred to vital human services, and they did not have to show up in institutions. They did not have to show up in emergency rooms. They did not have to show up in correctional facilities, because we were able to screen them and make sure that they got the basic fundamental message that they, in fact, do count. They do count. So the time has come. You know, Reverend Dr. Martin Luther King said we have to have a fierce urgency of now. Our governor understands he can't wait. He can't wait. He's got to do it now. He's got a masterful team, administrative team, making it happen. We've got elected officials making it happen at every level of government. So we are so pleased. I'm so happy to be serving at this point in my life. You know, if anybody told me that little boy from the west side of Chicago could, you know, just collaborate, just to help create and just take advantage of unique opportunities like this, I wouldn't have thought it possible. But it's possible right now, right here, right now, y'all. So as providers, let me just say that we are standing here poised, Mr. Governor. We thank you for your vision. We thank you for your passion. And we thank you for your commitment to the underserved people of the state of Illinois. We're going to make this happen, and we're going to impact opioid addiction in our communities. Thank you all so much.
Wow. How on earth can I follow that? Before I take, that's it. Before I take any questions from members of the media, I want to address the BA.2 Omicron subvariant, which is 30 to 50% more transmissible than the original Omicron and is causing surges in COVID caseloads in some places around the world. BA.2 was first detected in Illinois in January. To be clear up front, Illinois is currently in a good place. The number of admissions and COVID patients in hospitals continues to stabilize and drop across the state. That is what I look at most closely. That said, IDPH is watching the trend of this subvariant very closely. The virus is very much still here and with us, and it isn't going away. But with vaccines, with the existing variants that we have, they're manageable. However, we've seen other countries impose new mitigations because of their experiences with this more transmissible subvariant. With cases and hospitalizations low here and with COVID threats seemingly off in the distance, the last few weeks has given us some time to make sure that we're prepared for a potential next wave if it should come, whether it's BA.2 or any other variant. Our state stockpile is nearly fully replenished. We have more than 1.5 million rapid tests on hand, with 500,000 more on the way in the coming weeks. I'm also calling on all schools to consider their current testing capacity and make sure that they're prepared with a strong testing plan in place if we experience another surge. Testing allows you to monitor the prevalence of infection, which will help keep children in our classrooms and keep educators and staff safe. We're also talking to pharmacies and healthcare providers about increasing their inventories of the various FDA-approved oral BA.2 treatments in case you test positive. These COVID-19 medications are available with a prescription at most Walgreens and Walmarts in Illinois. However, for the pills to work, you must use them within 5 days of getting sick. So talk to your healthcare provider now to make sure that they can get you the medication in a timely manner if you do test positive. It's estimated that about 25% of current cases in Illinois are from that BA.2 Omicron variant. And although that percentage has been steadily rising, we have not seen a commensurate rise in cases or hospitalizations. In other countries, we've seen greater challenges from BA.2, which is why we are closely monitoring it. The world seems smaller, doesn't it? The world just seems smaller and more connected because of COVID. So what's happening elsewhere could possibly affect us right here. For now, though, things in Illinois are improving. If conditions here change, I'll address the people of Illinois with needed actions. If you want to know more about the current COVID-19 risk level in your community, the CDC produces a county-by-county transmission map for the public to stay informed. Just go to cdc.gov and you can enter your county to get more information. If you or your loved ones are considered high risk for COVID-19, protect them and yourselves with masks and social distancing in public places, no matter what the community transmission level may be. And of course, if you haven't gotten vaccinated yet, this is a great time to do so. That includes staying up to date with your booster. We also know that boosters work for this Omicron subvariant to reduce the likelihood of hospitalizations and deaths, particularly for seniors. The key is actually getting vaccinated and boosted. So go to vaccines.gov to find a first shot or a second shot or a booster shot near you. I want to thank you, and again, happy to take any questions from members of the media. Yes, sir.
Of Hospital Weekly, let's talk about intersectionality, about how health care is important, but also some of the other factors which influence addiction. And obviously, like what Guthrie Park in particular, and this whole medicine for last year in particular, have not seen much investment in quite some time. So is the state doing anything to put investment to address some of the economic factors and other factors?
So this is a great question, and I have to say, and although Representative Ford isn't still with us, I have to say that we are working very hard in Springfield together with the legislature to bring significant investments into the West Side, into the South Side of Chicago, into communities of color all across our state, because I recognize, and so do a majority of the members of the General Assembly, that too many communities have been left out and left behind. Investing in, for example, not just treatment for opioid addiction, but also mental health services, also making sure that we're providing job opportunities and training and workforce development all across our state. There are people who are looking for opportunities that can't get it. Remember, one of the other issues that we've faced, particularly, I'm going to talk about the West Side for a moment, has been that during COVID, so many people either lost their jobs or had to downsize the number of jobs that they were taking. Their income went down, and they were faced with the challenge of paying their rent. So we actually had one of the best and biggest rental assistance programs in the entire nation. We continue to provide support for people, both for rent assistance as well as for mortgage assistance. But again, focus on the communities where it's needed most. You also, one last thing, you saw when we implemented cannabis legalization, that dollars that come into the state because of taxes on cannabis legalization, actually a tremendous number of dollars are dedicated particularly to disadvantaged communities, communities of color, places that have needed it for far too long and that were affected adversely by the war on drugs. So there are many, many things that we're focused on. I don't want you to think that we've solved these problems or that we think we've solved these problems, but I do want you to know that we're focused on it and will continue to, and that the majority of the General Assembly is on board with it. Yes, sir. Hi.
Heroin was always thought of as an old man's addiction. Now, because of fentanyl and because of easy access, we're seeing more and more young people overdosing and becoming addicted. Is that one of the major thrusts of your new plan? And what is being done for fentanyl interdiction and prevention?
So I'm going to let our new leader, David T. Jones, join me up here. But I'll begin by just saying that it doesn't matter what age you are. Unfortunately, addiction affects everybody of any age. I can speak from personal experience that my mother had challenges both with alcoholism, and I think she was self-medicating, to be honest with you, for a mental health challenge. She never really overcame that addiction. And she was, when that really overtook her in her life, she was in her 30s. And she ultimately died of that addiction at age 49. And so this isn't about age. Now, obviously, we want to make sure and get to people as young as we can to address these challenges. But it can happen to anybody at any point in their lives. And we all know people, I think, that we think might be self-medicating, using whatever it is that's available to them. Might be alcohol, it might be something else. And so we want to make sure that we get those people into treatment and get them help as soon as possible. But if you don't mind, David.
And so the governor is absolutely correct. It's certainly, we kind of irrespective of age, we want to make sure that we are getting the most evidence-based treatment out. And so what we know is that there's two things. One, as was previously mentioned, medication-assisted treatment is the gold standard for treating opioid use disorder. And so we actually have expanded medication-assisted treatment. In fact, at one point in time, it was available in about 60% of the 102 counties that obviously make up Illinois. Now we have medication-assisted recovery available for all of the 102 counties. Moreover, as was mentioned, what we're also doing is making sure that naloxone, the medication that reverses the opioid overdose, is readily available. And so with Access Narcan, that's a program, candidly, that if you just go on the IDHS website, you can go on. Providers, Lee can certainly attest to it. If you go on, you can enroll as a drug overdose prevention program. You can get as much naloxone at no cost as you would like. Again, we are using some of the state opioid response funding to cover the cost of making sure that naloxone is readily available. And then we also are doing a lot to try to educate about, to your point, about fentanyl. We know that part of the challenge is that fentanyl is laced with both opioids and stimulants, and so we just are trying to make sure that folks are informed that with it, the supply is not what it used to be, and so we're doing a lot of education in some of the also anti-stigma campaigns. So there's a lot going on and a lot more to say, but I'll stop there.
Thank you. Anyone else? Thank you.